Okay, so the title of our research study here is Management of a Patient with Postural Orthostatic Tachycardia Syndrome. So POTS is currently accepted as a form of autonomic dysfunction, and it's characterized by certain symptoms like headaches, fatigue, dizziness, chest palpitations, nausea, etc. The one important thing to note here is that the physical therapy management of POTS is not really well established at this point. So the purpose of this case study is to try to come up with a multimodal treatment program for POTS.
The patient in this study is a 25-year-old female who was diagnosed with POTS. She presented to physical therapy with progressive syncopal episodes and light-headedness, dizziness, and chest palpitations in increased frequency over the past couple of years. The patient was not on any medical management.
This multimodal approach consisted of aerobic training, functional training, and strength training. This patient was seen 30 visits, about 60 minutes per session. The main outcomes in which we looked at were the subjective symptoms from the patient and the SF-36 scores. From visits 1 to 13, the average subjective ratings for the patient was about 60.5. Visits 14 to 22, about 35%. Visits 23 to 30 was about 30%. And the main three categories on the SF-36 that we concentrated were pain, energy, fatigue, and physical functioning. Pain at the end of visit 30 was about 27.5%. Energy and fatigue at the end of visit 30 was 20%, and physical functioning at the end of visit 30 was 12.5%.
So after participation in this multimodal exercise program, the patient had improvements in symptoms and improved scores on the SF-36. The improvements could be due to improvements in parasympathetic tone due to aerobic training components, which has also been observed in previous studies.
As a result of this case study, the authors theorized that the inclusion of aerobic, functional, and strength training methods when treating a patient with POTS may result in positive effects on the parasympathetic nervous system, which in turn would improve average subjective reports of lightheadedness, dizziness, chest palpitations, and/or quality of life.